In this video, we'll go over 11 warning signs of lung cancer. Stick around because we'll cover 3 extremely unusual signs that you probably have never heard of. Lung cancer is one of the leading causes of cancer-related deaths worldwide, but early detection can make a significant difference. Recognizing the symptoms is crucial, especially for those at higher risk due to smoking, exposure to pollutants, or family history. Here are 11 critical lung cancer symptoms that shouldn't be ignored. Number 1 is a persistent cough. A persistent cough is one of the most common yet frequently overlooked symptoms of lung cancer. While coughing can arise from various causes such as colds, allergies, or respiratory infections, it becomes a concern when it lasts for several weeks or progressively worsens without any apparent reason. A cough that lingers beyond 3 weeks, despite treatment or remedies, or one that changes in intensity or frequency, should not be ignored. Whether the cough is dry or productive, any noticeable progression or change may signal an underlying issue requiring immediate attention. When accompanied by additional symptoms like blood in the mucus, chest pain, shortness of breath, voice changes, fatigue, or unexplained weight loss, a persistent cough becomes particularly alarming. In the context of lung cancer, this type of cough may be caused by irritation from a tumor growing in or near the airways. Tumors can obstruct or partially block air passages, triggering a reflexive response as the body attempts to clear the obstruction. Furthermore, cancer-related inflammation or irritation in the lung tissue can also contribute to the persistence of a cough. The nature of this symptom makes it easy to dismiss, especially for individuals with pre-existing conditions like chronic bronchitis or asthma, or for smokers who often attribute it to a smoker's cough. However, any change in the nature, severity, or frequency of a cough, such as becoming deeper, harsher, or more frequent, should be taken seriously. Persistent coughing in smokers, especially, is a red flag that may indicate a serious problem, including lung cancer. While infections like bronchitis or pneumonia can also cause lingering coughing, these typically improve with treatment. A cough that persists or worsens even after treating such infections warrants further medical evaluation. Lung cancer-induced coughing often stems from tumor-related blockages, inflammation, or increased sensitivity of the lung tissue. Obstructions caused by tumors can make the lungs prone to infections, which further aggravate coughing. This cyclical irritation and infection risk make early recognition of a chronic cough essential for diagnosing potential lung cancer. Number 2 is blood in cough. Coughing up blood, even in small amounts, is a symptom that should never be ignored. Known medically as hemoptysis, this alarming sign often indicates a serious underlying condition. While blood in mucus or saliva may sometimes result from less severe causes such as a respiratory infection, chronic bronchitis, or a nosebleed draining into the throat, it can also signal more critical issues, including lung cancer. Recognizing the severity of this symptom and seeking immediate medical attention is crucial. In the context of lung cancer, hemoptysis occurs when a tumor damages blood vessels in the airways, causing bleeding. Even minor bleeding can present as streaks of blood in mucus, while more significant bleeding may result in larger amounts of blood being coughed up. Tumors within the lung or airways are often surrounded by fragile blood vessels that can rupture during coughing, physical strain, or as the tumor grows. This bleeding can also occur when cancerous cells invade surrounding lung tissues, making the symptom particularly concerning in high-risk individuals such as smokers or those with a history of lung disease. Number 3 is shortness of breath. Unexplained breathlessness or shortness of breath is a concerning symptom that can significantly impact daily life and often signals an underlying health issue. When it occurs without an obvious cause, such as exertion, stress, or known respiratory conditions, it may be related to serious medical concerns, including lung cancer. In the context of lung cancer, Breathlessness often develops when a tumor disrupts the normal airflow or interferes with the lung's ability to function properly. Lung tumors can cause breathlessness in several ways. As tumors grow, they may partially obstruct the airways, making it harder for air to move in and out of the lungs. This restriction can create a sensation of tightness or difficulty breathing, especially during routine activities such as climbing stairs, walking short distances, or even talking. Tumors may also press on nearby structures like blood vessels or nerves, further impairing lung function and leading to breathlessness. Another mechanism involves the reduction of the lung's capacity to exchange oxygen and carbon dioxide effectively. Tumors that invade or damage lung tissue reduce the amount of healthy lung available for gas exchange, leading to lower oxygen levels in the blood. This can cause a person to feel out of breath even when resting or performing minimal physical activity. Additionally, some lung cancers may produce fluid buildup in the pleural space, the area between the lungs and chest wall, causing a condition called pleural effusion. This fluid compresses the lungs, making it harder for them to expand fully and worsening breathlessness. If you're finding this video helpful, please like and subscribe. Number 4 is chest pain. Pain in the chest, ribs, or shoulder that persists and does not resolve with typical treatments can be an important symptom of lung cancer, particularly in advanced stages. This type of pain often indicates that the cancer has extended beyond the lungs and into surrounding structures, such as the chest wall, pleura, or even bones. Unlike pain associated with temporary conditions like muscle strain or minor injuries, cancer-related pain is often continuous, worsening over time and unresponsive to over-the-counter pain relievers. Lung cancer can cause chest pain when tumors grow large enough to exert pressure on nearby tissues and nerves. The lungs themselves do not contain pain receptors, but the surrounding areas, such as the pleura, the membrane lining the lungs, the chest wall, and the ribs, are rich in nerve endings. As the cancer spreads to these areas, it can trigger sharp, localized pain. If the cancer invades the bones of the ribs or spine, it can lead to severe, persistent pain that may worsen with movement, coughing, or even breathing. Shoulder pain, in particular, is often overlooked or misdiagnosed because it can be mistaken for muscle strain or joint issues. However, in some cases, shoulder pain associated with lung cancer is referred pain, meaning it originates from the chest or lungs but is felt in the shoulder. This can occur when the tumor affects the nerves that serve the shoulder region, such as the brachial plexus. Additionally, a type of lung cancer called a Pancoast tumor, which grows in the upper part of the lungs, often causes pain in the shoulder, arm, and upper back due to its location near critical nerves and blood vessels. Number 5 is unexplained weight loss. A sudden, unexplained drop in weight without any changes to diet, exercise, or lifestyle can be a significant red flag, especially if the weight loss is rapid or substantial. While it may seem harmless at first, particularly to individuals who might welcome a lighter scale reading, this type of weight loss can indicate serious underlying conditions, including advanced cancer. Lung cancer in particular is often associated with unintentional weight loss, as the disease profoundly affects the body's metabolism and energy balance. In cancer patients, unintentional weight loss occurs primarily because cancer cells consume an excessive amount of the body's energy. These cells grow and multiply rapidly, requiring a large energy supply to sustain their aggressive behavior. This can deplete the body's normal reserves of energy and nutrients, leading to weight loss even if the individual maintains a regular or increased food intake. In addition, cancer often triggers a condition called cachexia, a metabolic syndrome characterized by the loss of muscle mass and fat. Cachexia is driven by both the cancer itself and the body's immune response, which releases substances like cytokines that can alter metabolism, suppress appetite, and cause muscle breakdown. Weight loss associated with cancer may also be linked to reduced food intake. Tumors, especially those in or near the lungs, can cause physical symptoms like difficulty swallowing, persistent coughing, or shortness of breath, making eating uncomfortable or unpleasant. Number 6 is fatigue. Constant, unexplained fatigue is a pervasive and often debilitating symptom that can signal underlying health issues, including lung cancer. Unlike ordinary tiredness, which typically improves with rest, cancer-related fatigue persists regardless of sleep, rest, or reduced activity. This kind of fatigue can profoundly impact daily life, making even routine tasks feel insurmountable. It is a systemic symptom, meaning it affects the entire body, and may be one of the earliest signs of cancer for some individuals. In the context of lung cancer, fatigue often stems from several interconnected factors. First, the body's response to cancer plays a significant role. Cancer triggers the immune system to release inflammatory substances called cytokines, which can disrupt normal cellular processes and lead to feelings of profound exhaustion. This immune response, while intended to combat disease, can also alter how the body processes energy, contributing to persistent fatigue. Additionally, the cancer itself can exacerbate fatigue by consuming the body's resources. Cancer cells grow and divide rapidly, requiring a significant amount of energy and nutrients. This constant demand can drain the body's reserves, leaving less energy available for normal functions. The presence of lung tumors can also impair oxygen exchange, reducing oxygen levels in the bloodstream and further contributing to fatigue. Low oxygen levels make the body work harder to perform basic activities, compounding the sense of exhaustion. Number 7 is hoarseness or voice changes. If your voice becomes hoarse or changes tone, and these alterations persist without improvement, it may be a sign of a deeper health issue, including lung cancer. Voice changes, such as persistent hoarseness, raspiness, or a weakening of the voice, can occur when a tumor exerts pressure on or invades the nerves responsible for controlling the vocal cords. These changes may start subtly, with a slightly altered pitch or diminished vocal strength, and can progress to noticeable difficulty in speaking clearly or projecting the voice. The specific mechanism behind this symptom often involves the recurrent laryngeal nerve, a branch of the vagus nerve that plays a critical role in controlling the vocal cords. This nerve runs through the chest near the lungs and can be affected by tumors in the lung, particularly those in the left lung or the upper parts of the lung where it is more vulnerable. When a tumor compresses or damages this nerve, it disrupts the signals sent to the vocal cords, causing them to become paralyzed or function abnormally. This results in voice changes that do not improve with rest or typical remedies, such as staying hydrated or avoiding overuse of the voice. Number 8 is recurring respiratory infections. Frequent or recurring cases of bronchitis or pneumonia may indicate a deeper underlying issue, such as lung cancer. These infections often result from the presence of a tumor within the lung obstructing airflow and creating an environment that makes the lung more susceptible to infection. While bronchitis or pneumonia can occur in otherwise healthy individuals due to viruses, bacteria, or environmental irritants, repeated bouts of these conditions without clear external triggers should raise concern. In lung cancer, tumors can partially block airways, disrupting the normal flow of air into and out of the lungs. This obstruction prevents the clearance of mucus and other debris, which would typically be expelled through coughing or normal respiratory functions. The buildup of mucus creates a breeding ground for bacteria, leading to infections like bronchitis or pneumonia. Over time, the recurrent infections not only damage the lung tissue, but also make recovery more difficult, causing a vicious cycle of illness and impaired lung function. Number 9 is loss of appetite. A reduced desire to eat, often referred to as loss of appetite or anorexia, is a common and concerning symptom in cancer patients, including those with lung cancer. This change in eating behavior can be one of the earliest signs of an underlying illness and is particularly important because it often leads to unintended weight loss and nutritional deficiencies, which can weaken the body and impair its ability to fight disease. In cancer patients, the loss of appetite is multifactorial, influenced by changes in metabolism, tumor-related inflammation, and psychological factors. Cancer disrupts the body's normal metabolic processes. Tumors consume a significant amount of energy and nutrients as they grow and spread, which alters how the body processes and utilizes food. This shift in metabolism can lead to a feeling of fullness or satiety even after consuming very little food. Additionally, cancer-related cachexia, a syndrome characterized by severe muscle and fat loss, is often accompanied by a profound loss of appetite. This condition is driven not just by the cancer itself, but also by inflammatory chemicals called cytokines that the body produces in response to the tumor. These cytokines can interfere with hunger signals in the brain, suppressing the desire to eat. Number 10 is swelling in the face or neck. Swelling in the face or neck, especially if it appears suddenly or without a clear cause, can be a significant warning sign of an underlying health condition, including lung cancer. This type of swelling, medically known as facial or cervical edema, may occur when a tumor in the chest presses on major blood vessels such as the superior vena cava. The superior vena cava is a large vein responsible for carrying deoxygenated blood from the upper body, including the head, neck, and arms, back to the heart. Any obstruction or compression of this vital vessel can disrupt normal blood flow, leading to noticeable swelling in the affected areas. In the context of lung cancer, swelling in the face or neck often results from the physical presence of a tumor in or near the upper part of the lung or the mediastinum, the central part of the chest that houses the heart, trachea, and major blood vessels. When a tumor grows large enough to encroach upon the superior vena cava, it can partially or fully obstruct the flow of blood. This blockage causes blood to back up into the veins of the face, neck, and upper chest, leading to swelling, puffiness, and sometimes a bluish or reddish discoloration of the skin. In severe cases, the veins in these areas may become visibly engorged due to the increased pressure. Number 11 is bone pain. Pain in the bones, particularly in areas like the back or hips, can be a significant symptom of advanced lung cancer and may indicate that the cancer has metastasized or spread beyond the lungs. Bone pain associated with lung cancer often results from the invasion of cancer cells into the bone tissue, which can weaken the structure of the bones and cause persistent, sometimes debilitating discomfort. This symptom is especially concerning when it develops without any clear cause, such as injury or overuse, and worsens over time. Lung cancer is one of the types of cancer most likely to spread or metastasize to the bones. The spine, ribs, pelvis, and upper legs are the most common sites affected. When cancer cells spread to these areas, they disrupt the normal balance of bone remodeling, a process in which old bone tissue is replaced by new. This disruption can lead to both osteolytic lesions, where bone is broken down faster than it can be replaced, and osteoblastic lesions, where abnormal bone is formed. Both types of lesions can cause significant pain, fractures, and other complications. Bone pain caused by cancer often presents differently than pain from other sources. It is typically persistent and may worsen at night or during periods of rest, unlike muscle or joint pain, which often improves with rest. The pain may also become more intense with activity or weight-bearing movements, particularly if the spine or hips are affected. In some cases, the pain might be accompanied by swelling or tenderness in the affected area, or even by fractures, which can occur with minimal or no trauma due to the weakened state of the bone. If you or a loved one experiences one or more of these symptoms, especially if you have risk factors like smoking, don't delay seeking medical advice. Early diagnosis is key to successful treatment. Avoid smoking or quit if you do. Minimize exposure to secondhand smoke and environmental pollutants. Stay informed about screening options, especially if you are at high risk. Your health is worth the effort to act on these symptoms early. Don't ignore what your body may be trying to tell you. If you found this video helpful, please like and subscribe. Thank you for watching.